others. Getting to know your options by asking others. فأول شيء is obviously asking يعني تسألون other people who are في specialty مثلا R1s especially على السبيشالتي يعرفون they know about all these things. ف it's better to ask them. And prerequisites for acceptance طبعا كل specialty عنده specific requirements. people يسألوني يعني هل نحتاج حملات campaigns وكذا؟ لا ما تحتاجوا، بس تحتاجونها للهيئة points. They do not care about campaigns at all. يعني أنا ما and I still got accepted. يهمهم research. I did one ophthalmology research and that was enough. It was good quality. I showed a lot of interest في الانترفيو. فيعني حتى لو ما سويتوا research لا تشيلوا هم. As long as you show interest in the specialty, as long as you show interest in research, وعندكم at least one paper published حتى لو ما هي ophtha, it shows that you have a research background. Okay. بعدين is the sound clear now? People are saying إنه it's not clear.
كان يقطع الدكتورة بس الآن ممتاز.
الحين
إلى الآن يقطع الدكتورة.
Okay. Other prerequisite for ophtha that is probably the most important يعني besides the CV and research. طبعا is electives. You have to do a lot of electives. You have to get a lot of letters of recommendation, but they mostly care about your interest in the specialty. They don't care about the campaigns. They care about electives and they care about research. يهمهم الresearch clinical experience. Okay, and we'll get into that a little bit. The other thing and the most important thing in ophthalmology is the SMLE. You have to do well in the SMLE. If you don't do well, you will not get accepted. يعني هذا أهم شيء. يعني most people do not get accepted to the first phase اللي هو the total يعني when they الcutoff هذا it's getting higher and higher. You have to do well in SMLE. وحتى في الانترفيو بعد السنترز يشوفون ال SMLE score حقك. It's really really important that you do well. أنا in my year I got an 89 في SMLE where my GPA was 4.51 and I got in maximum points besides the dean's list اللي هو أتوقع 12 out of 20. فماي تراكمي was 83 point أتوقع 83 point something يعني 83.5 والcut off في رياض كانت 84. So it's really critical إنك تجيب as much as possible في SMLE. Okay, so those are the prerequisites for ophtha. بعدين the second thing is lifestyle. طبعا the lifestyle in ophtha is relatively يعني we'll get into it for the later slides, but it's relatively better than the other specialties. كمان نفس الشيء. Pay as a resident you get paid the same in all specialties. But in the future if you want to open private practice the pay is relatively better. يعني في a good private practice in the future. Okay, so you should ask these questions, these three main questions, and requisites with requirements, the lifestyle and the pay. You should ask these questions to the R1s about all the specialties you're considering. مثلا لو أنت محتار بين two specialties, try to gather this information. ثاني شيء get to know yourself. So get to know your options. بعدين ثاني شيء get to know yourself, your strengths, your weaknesses. What do I like? What do I dislike? يعني إيش أنا أحب وما أحب. What am I good at? What am I bad at? يعني strengths and weaknesses. And what do I value in life? يعني we get so caught up in medicine, but there are other things in the world that you value. And does your specialty play into your values? مثلا I really care about مثلا في ophthalmology people's sight. If you find that vision or blindness is a big issue for you, it's something that you personally value, then ophthalmology طبعا is the right specialty for you. But لو طبعا if you value human life then ophthalmology is not a suitable specialty for you because it's not a life-saving specialty. لو أنت you value مثلا communities and preventable diseases مثلا زي diabetes and hypertension, then again maybe you should go into something more like family medicine or something like that. But it's all ties back into who you are as a person and what you value. You want your specialty to align with what is important to you. Okay, so this is really, really important. Like, next thing, let's wait for the slide to change. Okay, so now I'm going to talk about why I chose ophthalmology. This is really important because this is really important because the interview. Okay, so why I chose ophthalmology, this is my personal journey and my personal journey with ophthalmology and why I chose ophthalmology. But you
دكتورة هبة.
can يعني use these things for the interviews. I liked neurology بس لما سويت
المعذرة على المقاطعة بس الصوت يقطع لسه.
Yeah. صوت يقطع. دقيقة. Just 1 second.
Take your time.
No.
بالنسبة للأسئلة إن شاء الله راح تكون عندنا فقرة Q&A في الأخير بإذن الله.
Is it clear now, my sound?
Yes.
Okay. It's about your personal journey, like I said. I didn't like any other medical specialty. I liked neurology. I tried it. I didn't like it. But I still wanted to do something related to nerves and sensory organs. I tried ophthalmology and I really liked it. I personally, I didn't like medicine. I didn't like studying medicine. I didn't like any of the specialties. But the ophthalmology was honestly the only thing that I really, really, really enjoyed. But that was one major reason why I chose it. The second reason is, like I said, I wanted to do something to do with nerves and sensory organs. So if that's something you're interested in, if the sensory organ is something you're interested in, if you like the pathways and the concept of nerves, but you don't like neurology or neurosurgery, I know that neurosurgery, the residency is 7 years, and neurology has a very poor prognosis, you're dealing with a lot of stroke patients, for example, then ophthalmology might be an option for you, okay? The third thing is ophthalmology is an artistic and visual specialty. So like I said, you have to get to know yourself and get to know who you are. I personally like doing art. I like drawing, I like painting, and I like visual things. So ophthalmology is a very, very, very artistic specialty. It's very visual, lots of colors, lots of spot diagnoses. So you'll be able to look at an image and immediately diagnose it. Everything is right in front of you to diagnose. You don't need a lot of investigations usually. So it's a very visual specialty, which I enjoyed. The other reason is you get fast and immediate results. So especially with anterior segment, you remove a cataract, خلاص, the patient's cured. He sees 20/20 again. You do a PKP or a corneal transplant, which is the PKP, and penetrating keratoplasty, the patient is cured. He sees immediately. He's very satisfied with his vision. You do LASIK, same thing, okay? Strabismus surgery, you fix a squint, خلاص, he's cured. So really fast and immediate results. Whereas other specialties, for example, internal medicine, you deal with chronic patients, poor prognosis, things like that, okay? So, and then the other reason is it combines both medical and surgical skills. And the fellowship is not that, it's not that much. Fellowship is 1 year or 2 years. So most people can do a double fellowship. Most people do like مثلا 1 surgical and 1 medical fellowship. And this is really important because مثلا they usually go for one medical and one surgical, because if something happens to their hands, or مثلا if they get older and they can no longer operate, if they have like tremor, or due to old age or something, then they still have a medical background, so they can stick to مثلا medical retina or neuro ophthalmology or something more medical. Okay, so this is really important. The other thing is it's also very rapidly changing and tech-based. Whereas other specialties, that if you're considering doing something like cardiac surgery, this is a dying specialty. It's becoming obsolete. Cardiac surgery is very rarely done now because it's mostly being replaced by interventional radiology. So this is something to consider. What is the future of your specialty? Ophthalmology has a very promising future. It's very tech-based. There are a lot of new machines, new discoveries every day. So this is one advantage. And then it is also fast-paced. Like I said, it's all about the spot diagnosis. You do not deal with chronic inpatients. If you don't like rounds, if you don't like internal medicine, if you don't like rounding on the patient over and over again, ophthalmology is for you. There are no inpatients. You only see inpatients, for example, like in it's a very short stay or post-op patient, but otherwise, or like, for example, a patient who needs, who's a uveitis patient who needs a steroid infusion or another medication infusion. So no chronic inpatients, basically. Minimal investigations. You don't need to really send them, for example, like a CT or an MRI. Yes, you will need to send them for things like a B scan or visual field, but these are usually done on the spot. They're done instantly in the clinic. So you don't have to wait for a long time. And it's very clinic-based. Like I said, you have clinic and OR. So everything is fast, everything is instant. Once you're done, you're done. You don't have rounds, and you don't deal with chronic patients, okay? Another reason why I chose ophthalmology is that it requires perfectionism. So if you're a perfectionist and you enjoy perfectionism and symmetry, then you'll like ophthalmology, especially the cornea. Cornea is all about symmetry. So they want the cornea to be perfect. If you want to transplant a cornea, then it has to be perfect, and you have to make the sutures perfect. Everything has to be perfect. So if you like perfectionism, then ophthalmology could be for you. And like I said, it's very fast paced, so it's very efficient. You have to be very efficient and fast. And you have to be attentive to detail, okay? So if you like paying attention to the details, then ophthalmology is the specialty for you. Next is when the eyes are the window to the body. So even though it's away from medicine, it still is representative of medicine, because any disease that manifests in the body can also manifest in the eye, to the point where you can also use it as a diagnostic tool, right? So if you have uveitis, this could be suspicious for example, an autoimmune disease, So the eyes are the window to the body. That's a major advantage. You get to see many eye manifestations of multiple diseases. And then the other thing is there's excellent potential for new discoveries in research, specifically diagnostic research. For example, in uveitis, personally, I'm really passionate about making uveitis or specific findings in uveitis a diagnostic criteria for certain autoimmune diseases. So, and then obviously more anterior segment, if you're dealing with the cornea, you're going to have research when it comes to different surgical techniques and different machines as well, okay? Another advantage is that there are minimal deaths. So if you get scared of killing the patient, or if you feel guilty for one of your patients dying, this is not something you have to deal with in ophthalmology very much. There are life-threatening diseases in ophthalmology, but they're not that many, is what I'm saying. Usually, if anything, they're vision-threatening, but they're not life-threatening. But some of them can be life-threatening. It's just not something we have to deal with a lot, okay? Most procedures are elective procedures, so you won't have to rush to the OR and do an emergency procedure unless it's an open globe injury, then you will, but that's also very rare. It helps improve a significant part of quality of life, which is vision, obviously. So if that's something you're passionate about, for example, if you may have a blind relative, or you may have a relative with poor vision, and if a close one or a loved one with poor vision, and if that's something you're passionate about, then of course go into ophthalmology. The next reason is that subspecialties are interlinked. and dependent on each other. So every rotation feels useful. If you do retina, if you do anterior segment, if you do neuro-ophtha, if you do glaucoma, they're all related. And I noticed that other specialties are not like that. For example, medicine. One person may be just interested in GI, another person may be interested in palm. Although they're related, طبعا medicine is related, the body is related. But I noticed that مثلا the residents, they get sick of the other specialties. They only want the specialty they're interested in. مثلا even GS. Like GS, if you're interested in breast and endocrine, you have to do liver, you have to do stomach, you have to do all these things. So hepatobiliary and all these other specialties, just so that you can do the specialty you're interested in. So the rest of the rotations, they feel kind of not stimulating or not interesting to you. As بالعكس الأوبتا, everything is interlinked and everything is related. So you're going to enjoy all the specialties and all of them are going to feel useful. So this is a really good point, okay? The other thing is, even though they're interlinked, they're also very vast when it comes to the specialties. Each specialty is still very different from the other. So there's good variety. You're going to see a good variety of patients. And then there's obviously a good work-life balance, which I know is a main motivator for a lot of people. If they value their hobbies, if they want to make time for their hobbies, their families, other things are important to them and they want good work-life balance, then ophthalmology is great. Relatively light on calls. Like I said, there are not a lot of life-threatening emergencies in ophthalmology, so the on-calls are relatively light. And there's obviously good potential for private practice, as I said before, okay? Some things to consider regarding the specialty, so some disadvantages. There's a steep learning curve. It can be overwhelming, especially the basic science course. For those of you who don't know, the basic science course is a 2-month-long course that you take in the beginning of a residency here in Saudi Arabia. Everyone in Saudi Arabia has to come to Riyadh and attend these lectures for 2 months. It's very overwhelming. It's very heavy. It's usually full days of lectures all day. And the lectures are usually, they vary, but most of them on average are around 100 to 150 slides long. It's a lot of information, okay? So it can be very overwhelming. And like I said, ophthalmology is kind of outside of medicine. And usually our ophthalmology courses that we take in medical school are not enough. They don't really cover enough to know ophthalmology to start your residency. That's why the basic science course exists in the first place. But it can be really overwhelming. And like I said, the learning curve is really steep. It's going to take a long time to climb up that steep learning curve, okay? And then the second thing is it is mostly skill-based. So you deal with a lot of skills. You will not have to really think about the diagnosis because, like I said, it's a spot diagnosis. Patients coming with redness and itching, the patient has an allergy. There's nothing else, yani. طبعا you have to come up with differentials, but it's not as vague. It's very clear. It's a very visual specialty. So everything you see in your examination is basically your diagnosis. However, the thing you will struggle with is not the diagnosis. The thing you're going to struggle with is the examination itself, the skill-based procedures like examination. You're going to have to learn how to use the slit lamp and the lenses and the gonio, which is how to see the angle. You have to use a gonioscope. You have to use the Goldman applanation tonometer, which is how to measure IOP. You have to use the tonopen. There are so many gizmos and gadgets and tools that you have to master in ophthalmology in order to become a good ophthalmologist, okay? And طبعا you have to deal with suture removal. We do suture removal in the clinic. We do intravitreal injections. We do laser. And laser, I mean retina laser, you're going to have to learn how to do that. You're going to have to do laser for the iris to open up the iris in something called the peripheral iridotomy. You're going to have to do minor procedures like chalazion removal and taban surgery because it's a surgical specialty. So these are all the skills that you'll need to learn, and you need to learn them by like maximum R1, R2. So you really have to work on your, it's a hands-on specialty, okay? And the two disadvantages of that is it requires consistent practice, especially in the beginning phases like R1, R2. It's not good to take long vacations because once you come back, it's all muscle memory and your muscle memory will be lost. Once you're in R3, R4, it'll get a little bit better. You can take longer vacations, but in the beginning, you have to keep your skills really sharp and you have to reinforce that muscle memory. And then another thing to also consider about the skills is that the OR it's all microsurgery. It's all under the microscope. So the hand-eye coordination also takes some time, and this also includes in the slit under the slit lamp. When you're examining the patient under the slit lamp, that is also a microscope. And you also have to learn how to مثلا invert the lid. You have to invert the lid for checking for foreign bodies, for example. So even that's a skill you have to learn. There are so many skills that you have to learn in ophthalmology, okay? And then another disadvantage about the skill-based is how good you are as an ophthalmologist is highly dependent on your exposure, and your exposure is highly dependent on what your senior or what you're attending or what your consultant allows you to do. مثلا if they don't trust you to do مثلا cataract surgery, then you won't do cataract surgery. So, and you won't get that exposure. So it's really important that you have a good relationship with your consultants so that they can give you that exposure that you need, okay? The other thing to consider is, like I said many times during this lecture, you have there's an unfamiliarity with the specialty. You don't know a lot about it. There's a lot of new terminology and abbreviations that you need to learn, but honestly, that's fine. If you do a couple of electives or even one elective, you'll be fine with that. You'll read the notes and you'll pick it up really fast. Like I said, life-saving situations are rare. This ties back into what I've said about how it has to align with your values. So if your value as a doctor is I want to save lives, I want to make a big impact and save lives, ophthalmology is not the specialty for you. You will not save lives when it comes to ophthalmology. Yes, you will improve quality of life, you'll improve vision, and sometimes you'll save lives, but not all the time or not most of the time. So that's something to consider. Another major thing is that it's a competitive field. So always have a plan B. That's just trying to be realistic. So it's really hard to get in. And even after you get in, it's really hard to get a fellowship. So just take that into consideration. And but at the same time, don't give up hope. And I'm always a firm believer that if you're really passionate about something, then you should try your best to get it. So don't be discouraged about the fact that it's competitive. You can do it. But it is something to consider just to have a plan B and to be realistic, okay? The other thing is poor doctor-patient relationship. So again, this ties back to your values. If you value having a good relationship with your patients, like for example, a person in internal medicine or a person in family medicine who builds that patient-doctor relationship, ophthalmology is not for you because you deal with short-term patients. You do not deal with chronic patients, okay? The other thing to consider is the ophthalmology requires good BSV, which is binocular vision. Binocular vision is basically deals with your depth perception. You have to have good visual acuity. You have to have good color vision. They test for all these things before you start your rotation. So make sure that you have good vision. If you have like a squint, if you have esotropia or exotropia, then just make sure that you have good stereopsis or good fusion. Okay, that's something to consider because that was a personal issue that I had with my residency. I have accommodative esotropia, and I was treated for amblyopia as a child, and they saw that in the interview, and they made me do a bunch of tests. So to test for my depth perception. So that's something to consider as well. Another thing is some subspecialties have a relatively poor prognosis. I know that I just said that they have good prognoses, such as anterior segment and strabismus, but other ones have poor prognoses, such as glaucoma and retina. Okay, so that's something to consider as well. And the last thing, honestly, I don't really care about this, but some people may care about it, is disrespect amongst other specialties. So other specialties may look down on you or may say like you're not really impacting medicine in a strong way. Like all you do is give eye drops, or some people may misunderstand you and say like, oh, so you're an eye doctor, that means you give glasses, or like stuff like that. If you are able to not care about these comments, then that's good. But if the prestige and stuff, if it bothers you, then that's something to consider. But honestly, it doesn't matter because, in my opinion, ophthalmology is a very prestigious specialty. So so other people's comments shouldn't really bother you. But I thought I'd put it in there because it's an important point to talk about, I think. Okay, so that's it. I think I'm done. Does anyone have any questions? We can start with the chat.
اوكي الآن إن شاء الله راح نبدأ باستقبال الأسئلة. اللي عنده أي سؤال يكتبه بس في الشات.
Okay, so a lot of people are asking about research. So what I did to get my research was I actually did my first ophthalmology elective in Korea, and I was offered to do research there because I was a really, really, really proactive member of the team. I would always ask questions, and I was really interested in ophthalmology. I always came on time. I showed interest all the time. I never left early. I stayed until 7 p.m. These are, you have to have good work ethic in order to develop a good relationship with your consultant. And if you do that, if you show up on time, and if you don't, leave the clinic early, and if you show interest, then you will have offers of research. Another thing, a lot of mistakes that a lot of people do is that they will just ask the consultant for research. They find that very insulting and very lazy, okay? Ophthalmologists are, how do I say this? They believe that not everybody deserves to be an ophthalmologist, okay? They believe that only the brightest people, the smartest people, the best people deserve to go into ophthalmology. And so if you show that you're not interested, then they will not like you. So if you just ask والله دكتور أبغى research, they will not respect you. But if you show genuine interest, you tell them, I'm interested in this topic, I have an idea in this topic. مثلا قريت a bunch of research papers, I wanted to know your opinion about this. If you put in the effort if you put in the effort and you put in the work, and you show them that you're genuinely interested, and you come with them with an idea, even if it's not a good idea, then they will help you, and they will say, okay, this is a good idea, but I have a better idea for you. And this is what happened to me with one of my consultants. I told them I was interested in doing research. This is my idea. And they said, والله ما عندنا lots of patients with this disease that you want to research. ولكن I have this other paper I'm writing that I want you to be a part of. فتخيلوا هو عنده فكرة, هو already عنده a research, but all you need to do is give them your ideas and show them your interest. But if you ask them directly, والله أبغى research, they're going to say no. They will say no because they will feel like you're lazy and that you're not actually interested in ophthalmology. So show genuine interest in the clinic. Ask smart questions. Do not ask stupid questions that you can Google. I do not ask questions that I can look up on Google. أول شيء I look on Google. لو ما لقيته on Google, I will ask. And this is how you ask smart questions, okay? But these are just tips on how to impress them in the clinic, how to get research opportunities, how to have good work ethic in the clinic, and also how to get letters of recommendation. This is how to present yourself in the best way possible. Okay. The best centers, someone asked about the best centers in Ophtha. The best centers are King Abdulaziz University Hospital in Riyadh and KKish in Riyadh. Another strong program is the Jeddah-Mecca joint program is also really a strong one. People really want to go there. It's usually their second option. But those are the strongest ones. The Jeddah-Mecca joint program, there's no specific hospital. You rotate in multiple different ones, okay? So those are the best ones to answer your question. Someone else asked, is a lot of physics involved? Yes. Especially in the basic science course, a lot of physics is involved. You learn a lot about optics and light and all that stuff. But honestly, in clinical application, it's not that much. But you do need to learn it in your basic science course to pass the exam. And for this basic science course thing, most of the questions are repeated. So I honestly didn't study, and I got a high score because I studied the past questions. But it's kind of like SMLE. It's kind of like تصحيح الأسئلة السابقة, or you just go into the exam. Okay, so that شيء مهم. I was just saying, the basic science course نفسه is heavy, لأنه it's overwhelming. The lectures نفسها ثقيلة okay. The second question this person asked is, does it get monotonous or boring, or do you see a lot of interesting cases? It really depends on the center. So some centers like KKish, because they're an eye specialist hospital, so you see a lot of advanced cases, you see a lot of interesting cases. If you do مثلا if you do rotations abroad, مثلا في Canada, you're not going to see a lot of interesting cases. ليش? Because most of them are controlled diabetics. You're going to see mild NPDR مثلا, okay? But if you do a rotation مثلا في السعودية, you're going to see a lot of interesting cases. ليش? عشان عندنا a lot of consanguinity, but there's a lot of unique syndromes. And there are a lot of people coming from rural areas who have complicated complications or late stages of the disease. مثلا, you're going to see vitreous hemorrhage, you're going to see retinal detachment, you're going to see endophthalmitis. But you don't see this in the West with more developed, they're more developed countries, but you don't see the advanced stages of the diseases. So it really depends on the center, and it really depends on the region. From my experience, KKish and King Abdulaziz University Hospital and King Khalid Eye Specialist Hospital, اللي هو KKish, they have really good exposure. Really, really, really amazing exposure. Okay, so in surgical specialties, how do I know that I have good surgical skills before entering a surgical specialty? You will not have good surgical skills. I know I don't have any surgical skills, but I went into Ophtha and I'm here to learn. Yani, most people, some people, not most, but some people do like a surgical course, a suturing course. I never did any of that stuff, and I'm fine. Yani, like you'll learn it with time. Yani, they have simulators, and you can practice on artificial eyes. You can practice on مثلا fruit. A lot of doctors, they recommend that you practice suturing في البيت. You just buy like a suturing kit and you practice في البيت. You practice with like a tomato or a grape or something, and you practice. So don't feel pressured to do any of that extra stuff. I honestly never did that stuff, and I'm fine. Yani, I still got accepted, and I never felt yani, that it's like a big deal. And they also, in the basic science course, they do like a suturing thing, like they do like a suturing session, and I was fine. Yani, I did really well actually, and I never did suturing before under the microscope, so it's fine. Is there a program in Medina? Yes, there is a program in Medina from what I know. If I'm not good with surgery, is ophthalmology not an option for you? If you don't like surgery, ophthalmology is not an option. But if you like surgery, yes. You, as a medical student, especially in the Middle East, you're not going to be a competent surgeon. You don't have a lot of surgical exposure. Yani, حتى as an intern, I didn't do much. Yani, I just did some suturing. Yani, I sutured the scalp once, مرة في حياتي. Yani, it's not a big deal. I'm not good at surgery, but I like surgery. That's why I went into ophthalmology. Okay, so is it an advantage if you graduate from abroad? Yeah, it's an advantage because if you get sponsored, then you will have a job when you get back. And the training in general is said to be better abroad. ولكن, like I said, there are disadvantages to that. The first disadvantage is you're not going to get a lot of exposure when it comes to مثلا the unique cases in the Middle East, زي ما قلت, syndromes, advanced stages or late stages or end stages of the disease. You're not going to see any of that stuff هناك. وكمان you're going to be on your own most of the time. يعني هنا في Middle East, your seniors will really take care of you. They'll really make sure that you get the best teaching. هناك, they don't care about you. يعني you're going to be on your own most of the time. The on-calls, you're on your own. هنا لا. هنا you have first on-call, second on-call. Abroad, what I know in Canada, if you call the second on-call for a stupid reason, then they will report you, or they'll tell the staff. يعني they'll tell your senior consultant إنه oh, she doesn't or he doesn't know how to treat the corneal abrasion. يعني the standards هناك are a lot higher, so it's more difficult. الرesidency هنا لا أخف, they're nicer, they're easier on you, and it's just a more cozy environment. But in terms of training, yes, you will get good training abroad. How many studies should I do to get a match in ophthalmology? I think you mean electives, or studies like research. I think you should just do at least one ophthalmology research, or at least one research in general. In terms of electives, I personally did 6 electives in ophthalmology before I applied. But do as many as you can. About my research, what was my research method? My research method was it's called a medical record review. So it's a retrospective study, and it was a review of the medical records. That's it. And if you didn't do an elective in the center I'm applying to, will that weaken my chance? Yes, it will weaken your chance if you do not do an elective in the specialty you're applying to. However, if you have a good CV, it'll be fine. يعني مثلا أنا I did all of my electives in Riyadh and I still got accepted in the Jeddah Mecca joint program, so it's fine. But I do recommend that you do if you can, you do an elective in the specialty that you're interested in, the center that you're interested in. However, if you did not, you still have a chance. Yani, just impress them in the interview and have a strong CV. Do you think that an ophthalmology is an OPD-based specialty? Absolutely. It's an outpatient department-based specialty. I have rotated in ophthalmology for the past month, and I have not entered the inpatient ward once. Yani, it's kullu clinic and then 1 day of OR. So 4 days of clinic and 1 day of OR. So yeah, it is very, very much clinic-based. What are the important courses that we can take prior to interviews? Wallahi, nothing. Yani, I didn't take any courses. Some require the BLS course, so just make sure you have the BLS and ACLS courses. Other than that, like you can take extra courses like the microsurgery course, for example, and all that stuff. But I didn't do any of that stuff, and I still got accepted. Yani, they don't care. Like I said, they don't care about courses, and they don't care about campaigns. They care about two things: research, electives, and طبعا زي ما قلت الSMLE. These are the 3 most important things. If I have mild myopia, does it affect my acceptance? No, it doesn't. It just it only affects your acceptance if you have a high hyperopia or amblyopia, like amblyopic or amblyogenic eyes. If you have any problems with your IOP, if you have glaucoma, they care about this stuff. But mild myopia, they don't care about it. Can you please talk about the environment and relationships with other ophthalmologists? I see this as a great positive, as many other specialties are quite toxic. Yeah, the relationship between the doctors are pretty chill. And within GS, they're toxic because it's stressful. Ophthalmology is not stressful, and so the environment is cozy. It's very chill. It's very relaxed. Yani, I had a really positive experience. طبعا the consultants are very tough on you. I'm not saying it's easy. They are tough on you and they expect the best from you. They do not like lazy people. They do not like مثلا residents who leave early طبعا. They want you to have a good attitude. But if you are a good resident, they will be nice to you. But in GS مثلا, if you are a good resident, they will be mean to you. يعني لا, it's a good relationship overall. Is ACLS needed? No, ACLS I think is not needed. I think BLS is needed. I had to submit my BLS in order to get accepted. So just keep that in mind. How can I contact you? You can contact me. You can contact me through Telegram. I'll send a dot on Telegram now, and you can contact me through Telegram here. So I just sent a dot on Telegram for you can contact me. How does one set up an elective abroad? What do you recommend doing in international electives? Anna, I was a KSU graduate, King Saud University graduate in Riyadh, and the elective that I applied for was actually an affiliation with my jama. Yani, I didn't apply independently. I applied through my university. But however, if you want to apply for an elective abroad, I recommend that you apply for Canada. Look through the Canadian portal. Just Google Canadian portal electives, and it should come up, the website, and you can apply for an elective there. What year do you recommend? I recommend you apply after your ophthalmology rotation. So if it's in 4th year, you should apply after 4th year, for example, during summer vacation or during your elective period. But I recommend you do it after your right after your ophthalmology course in medical school, just so that the information is fresh. Someone asked about the basic science course. How long is the course? It's 2 months. And there is an exam at the end of the course, and it is 20% of your total promotion. So your promotion exam is divided into the part exam and the basic science course exam. 80% is the part exam. It's في اختبار اسمه part. 80% is the part and 20% is the basic science course. Okay, it's not a big deal. كلها أسئلة يعني مكررة, so it's going to be fine. Don't worry about it. Someone asked, do you hear the specialty is saturated in main cities? No, I didn't hear about that, to be honest. It is overly saturated in terms of fellowship. It's really hard to find fellowship positions now. I know مثلا in something to consider مثلا في KKish in Riyadh, the priority goes to KKish residents. يعني الفellowship, the priority goes to KKish residents. فالناس اللي في عبد العزيز they're struggling to find a fellowship. مثلا زي أشياء زي كده. بس in terms of oversaturation, I've never really heard anyone talk about that. Okay, so someone asked, can you talk about the study in residency? Is there time for doing other stuff? For example, my hobbies. During residency, not really. And residency for everybody is going to be difficult. You're going to have to study all the time and all of that stuff. But I think if you manage your time really, really well, you're going to have like enough time on the weekends. You're going to have like set one day off for your hobbies or for going out. I will say that it's not as bad as other specialties. Yani it's relatively lighter, but it's still pretty heavy. Okay, so does anyone have any other questions?
هل في أحد عنده أي
something I want to also mention is that you can be a good resident and you can be an average resident. Okay, average residents, they don't study, they don't really do anything. يعني they just attend the teaching. احنا عندنا academic half day, so one day a week you get half day off for teaching. يعني في lectures محاضرات كده. فهم بس يحضرون و they don't actually participate في interactive cases. Usually they're interactive cases في ال teaching sessions. Usually they don't participate, or يعني they finish the clinic quickly. They just want to finish مثلا there's a diabetic screening clinic وكلهم خلاص يعني they don't want to do anything. They just examine the fundus quickly and then they let them go. يعني مثلا في average residents, and if you want an easy life and if you want time for your hobbies, you can make time and still be a good resident. It's difficult, but you can still do it. وفي بعض الناس لا, like they're average and they have time. So it depends on you. يعني most of it depends on how much time you spend on things. It's obviously the outcome is going to be different. So if you spend more time on fun, you won't be as good of a resident as someone who spends more time on their studies, you know? So, but for ophthalmology, I will say it's relatively lighter, but I just wanted to mention that point. And you can make it harder on yourself if you want to, and you can make it easier on yourself if you want to. But that's also it's up to you, يعني في choice. Okay. What inspired you to start OSS? I honestly wanted to start it because I wanted a place where everyone can help each other out with ophthalmology. I know that ophthalmology is a very niche thing. Not a lot of people are interested in ophthalmology. And people who are interested are usually very interested in ophtha because يعني it's برا medicine. يعني it's a really يعني زي ما قلت, it's niche, it's kind of an exclusive thing. So I wanted to help everyone, and I wanted everyone to help everyone else. So that's the main reason why I started it. I started it, I think, like 2 years ago. How can we contact you? زي ما قلت, I sent a dot on Telegram. I'll send one again. But this is just contact me. Contact me if you have any questions. My knowledge about ophthalmology is 5% while I'm an intern, because not the same knowledge for other specialties. So is that barrier? Yeah, that's a barrier. I would say increase your knowledge in ophthalmology. So someone is asking, my knowledge is not يعني below average, or it's not the same as my knowledge of other specialties. You have to be knowledgeable in ophtha. You have to start reading. What I did, I never studied in any rotation that I did. I never studied as an intern. In my electives, I wrote notes for the clinic, and every single case I learned, I would go home and read about it. Okay, I didn't study. I just kind of يعني, oh, this is interesting. I want to learn more about مثلا today I saw a diabetic retinopathy case. I'm going to go home and read about the retina. I'm going to go home and read about diabetic retinopathy. But كمان, I wrote everything down that the residents told me, that the consultants told me, عشان they teach you in the clinic. But if you write everything down, I made notes. وسويت كمان flashcards of things that the consultants taught me and that the residents taught me. Okay, and I studied those every single morning. I stopped reading from books حتى ما احتجت أقرأ حتى, because all of my knowledge was from the consultants and the residents. They teach you everything. You just have to write it down and study it. That's all you need to do. If you don't like opening books, if you don't like studying, أنا ما أحب أذاكر. This is what I did. I just studied the stuff that they told me, and that is more than enough. يعني I impressed them a lot because they teach you things حتى برا الكتاب, برا الكتب. But it's really important that in the electives, you carry a notebook with you or your iPad with you. You take notes and you study everything that they say. Okay, this is how you increase your knowledge in ophthalmology. If you don't have time for electives, then you have to read books. You have to start increasing your knowledge. This is really important. Okay. What is the Kekish Grand Round? It's basically a bunch of lectures once a week. And is it helpful as a medical student? Not really. Even me as a resident, some things are a little bit more advanced. So I would start with basically the basics of ophthalmology, the anatomy, physiology, all of that stuff before attending these grand rounds. Don't worry, you're not missing much. It's not a big deal if you miss them. As a medical student, I don't recommend it. It's a waste of time for you as a medical student. You will not benefit. You want to do something efficient, high yield, something that's beneficial for you. Maybe if you attend the grand round, you're going to spend 5 hours attending a grand round and only understand 2 things. Or you can spend 5 hours studying basics of ophthalmology and gain 100 things. So it's up to you. This one is efficient and one is not efficient. So I don't recommend attending the grand rounds at your level. Is one summer elective enough? It's not enough. I think you should do more than one summer elective. However, if you cannot, then you have to impress them through other ways. مثلا في الانterview. But like I said, I did 6 electives in ophthalmology. Every single elective, I did it as ophthalmology. Okay, that's something to consider. Someone asked if my interest in ophthalmology is just newly found. Is it worth trying to get accepted? Absolutely. There are people who were interested in ophthalmology late. But you can catch up. Like I said, anything is possible. Everything is possible. So just try your best. Try to get as many electives as possible. Try to get as many letters of recommendations for elective method. If you only have one elective, make the best out of your elective. Okay. Ask the residents, program directors, or who are the important people for the interview, and then try to rotate with them. Okay, this is really important. Okay, try to rotate with the program director, try to rotate with the people that are going to interview you. So try to get letters of recommendation from them, stuff like that. Try to get them to really know you. So make the best out of the limited time that you have. Would you say it's a
Yes.
I
got a question. If color blindness can affect the acceptance.
Yes, this is true. Colorblind, for some it's a requirement. So with me, I had accommodative esotropia, and I have poor stereopsis, which is poor depth perception. I cannot perceive depth. I perceive depth lower than the average person. بس لما طلبوا التست مني طلبوا كمان color vision. Okay, so they did a full comprehensive ophthalmology exam on me, and one of the things was color vision. So this is something, yes, that definitely affects your acceptance. You have to make sure about this with your program, that you're aiming for specific requirements for your program. But from what I know, they only هم بس طلبوا مني التست عشان أنا كنت لابسة نظارة high hyperopia. فهم لاحظوا إني كنت لابسة النظارة وسألوا مني إنه like they طلبوا مني التست. فبس I would recommend, just so that you can be a safe ophthalmologist, you let them know you have a color vision problem. Okay, you want to be an honest and safe doctor at the end of the day. So make sure with your program, if you don't want to directly ask a program director, you can ask مثلا a resident. You can ask someone junior to find out for you. If you don't want to announce it you don't want to ruin your chances for the interview, you can ask مثلا a junior to find out the requirements of this. Okay. Someone asked, if my interest is newly found, we already answered. Would you say it's a competitive specialty? Yes, it's extremely competitive. The total is getting higher, like I said, every year. Is it recorded? Yes, the lecture is recorded. Yeah, you already answered that. My degree in ophthalmology was, my grade in ophthalmology was a B. Will it affect my acceptance? No, I also got a B in ophthalmology, by the way, and I got accepted, so it's fine. It's no big deal. I didn't study for that test. I got a B in ophthalmology, and they still accepted me. And then the clinical attachment في العيون 6 شهور. هل احتاج elective كمان? I think a clinical attachment for 6 months is really great. I think that's enough. But if you want to do more, then that's fine too. Yani it really is up to you. Like I said, I did 6 electives. Some people did, I know some of my other colleagues, they did 4 electives, they did 3 electives, and they still got accepted. I did 6 electives and I got accepted. So I think the minimum you should do is at least 3 electives. 2 electives, 2 to 3 electives minimum. Okay. Does anyone have any more questions? Yeah, 85.5 is really good. I got 83.5 and I got accepted into the Jeddah Mecca program. But I did not get accepted in the Riyadh program. Riyadh they have a very high cutoff, so be very careful. I think for Riyadh it's safe. 86 should be good for this year, because last year I heard the cutoff is 84, 84.5. I think 86, 85.5 should be fine for Riyadh, and it should definitely be fine for the other cities, inshallah. What is the minimum GPA? My GPA was 4.51. It's not about the GPA, it's mostly just about the total. So your total GPA with the SMLE, with the CV, should be all above, I think, at least above 85 or 85 or above. In terms of هل ما فهمت سؤالك، صعوبة الريزيدنس مقارنة بالتخصصات الثانية، كيف صعوبة من ناحية الإيش؟ من ناحية relationship, like if they're tough on you من ناحية الدراسة. Yeah, no, it's fine. The studying is okay. It's fun. If you like ophthalmology, it's really great. If you're a visual learner, it's great because it's all pictures. And it's not difficult. The only thing, like I said, there's a steep learning curve. So you will feel overwhelmed في البداية. بس you will be fine. You will be fine. Within 1 month, you'll be totally fine. It'll be a second language to you. You will know everything about the basics of ophthalmology. But just make sure that you study from good sources. We have a blog post about the best books for ophthalmology. وكنت كاتبة أنا the pros and cons of each book. But I highly recommend you check that out. I'll post the blog post in the Telegram group for those who want to read it.
هل في أي سؤال أو إضافة؟ تمام، وصلنا إلى ختام المحاضرة. الله يسعدك دكتورة هبة. Thank you for this lecture and thank you all for attending.
Thank you. I appreciate everyone who attended. وبالتوفيق.
شكرا جزيلا دكتورة.